All right, so this is the second part of COPD. We just reviewed chronic bronchitis, and now we are going to review emphysema. And emphysema means inflate or swell, which makes sense because in the lungs of people with emphysema, the alveolar air sacs, which are the thin-walled air spaces at the ends of the airways, where oxygen and carbon dioxide are exchanged, become damaged or destroyed. The alveoli permanently enlarge and lose elasticity, and as a result, individuals with emphysema typically have difficulty with exhaling, which depends heavily on the ability of the lungs to recoil like elastic bands. Emphysema is actually lumped under the umbrella of chronic obstructive pulmonary diseases of COPD, along with chronic bronchitis. And the two differ in that chronic bronchitis is defined by clinical features, as you know, like productive cough, whereas emphysema is defined by structural changes, mainly enlargement of the air spaces. That being said, they almost always coexist because you know that smoking is that causes these problems. All right, so emphysema is a form of COPD that is based on structural changes in the lung, specifically a destruction of the alveoli. Normally, oxygen flows out of the alveoli and into the blood, while carbon dioxide does the opposite. But when the lung tissue is exposed to irritants like cigarette smoke, it triggers an inflammatory reaction that upsets the delicate alveolar walls and affects the flow of gases. All right, so inflammatory reactions attract various immune cells, which release inflammatory chemicals like leukotriene B4, IL-8, and tumor necrosis factor alpha, as well as proteases like elastases and collagenases. All right, so these proteases, break down key structural proteins in the connective tissue layer, like collagen as well as elastin, which is a protein that gives the tissue elasticity. And this leads to problems seen in emphysema. In healthy lungs, during exhalation, air whizzes through the airway with high velocity, creating a low pressure environment in the airway. This is due to the Bernoulli's principle, where as a fluid, which includes air, moves at higher velocity, it must have lower pressure. Now, this lower pressure tends to pull the tiny airway inward. Strong, healthy airway walls full of elastin can withstand that pressure and don't collapse. They hold the airway open and allow air to fully escape during exhalation. But with emphysema, that elastin is lost, which makes the airway walls weak and allow that low pressure to pull the walls inward and collapse during exhalation. And this leads to air trapping because the collapsed airway traps tiny bit of air, distal to the point of collapse. Also, this loss of elastin makes the lungs more compliant, meaning that when air blows into them, they easily expand and tend to hold onto that air instead of expelling it during exhalation. And so the lungs start to look like large, thin plastic bags. The loss of elastin also leads to breakdown of the thin alveolar walls that are called septa. You can see them in the video. Okay, I stop it now. Okay, you can see it in the video how they disappear, those septa. Without these walls, neighboring alveoli coalescence into larger and larger spaces. And that means that less surface is available for gas exchange. So this affects oxygen and carbon dioxide levels. All right, so this process all happens in the acinus, which are the endings of the lung airways where those clusters of alveoli are located. Different types of emphysema affect the acinus slightly different. The first pattern of emphysema is called centriacinar emphysema, and this is the most common pattern, and it really only damages the central or proximal alveoli of the acinus. This is the pattern seen with cigarette smoking, and is thought to happen because the irritants from smoke aren't able to make it all the way to the distal alveoli. Centriacinar emphysema typically affects the upper lobes of the lungs. There is also a paraacinar emphysema, where the entire acinus is uniformly affected, and this is often associated with genetic condition of deficiency of alpha 1 antitrypsin. Now, in healthy individuals, macrophages are always letting out some proteases to help clear the debris that occasionally finds its way into the acini. But those proteases break down proteins, right? So this can damage the tissue. Alpha 1 antitrypsin is a protease inhibitor generated by the body to protect against unintended collateral damage from the proteases. So people with alpha 1 antitrypsin deficiency don't have these protective proteases inhibitors, and so they end up with damaged air sacs that affect the entire sinus. Paraacinar emphysema typically affects the lower lobes of the lungs. Okay, you'll see they are all three different. A third and final type of emphysema is called paraseptal emphysema, in which the distal alveoli of the acinus are most affected, and this type typically affects the lung tissue of the periphery of the lobules, near the interlobular septa that separates each lobule. The thing to keep in mind about paraseptal emphysema is that the ballooned alveoli on the lung surface can rupture and cause a pneumothorax, okay, which is when air gets in the pleural space, and then this pressure that goes into that pleural space can't make the lung collapse. Alright, so people with emphysema typically experience symptoms like dyspnea, which is a shortness of breath due to the air trapping and diminished gas exchange. To help counteract this, people sometimes exhale slowly through pursed lips, which increases the pressure inside the airway and prevents the collapsing of the airway. This way of breathing explains the nickname of these people. They are called pink puffers, since individuals are able to oxygenate their blood, so they are pink, no blue like they are in chronic bronchitis, but have to purse their lips to do so. All of this constant energy spent on breathing can even cause weight loss, so they look like cachexic or anorexic. Over time, though, as more and more lung tissue is affected, emphysema can lead to hypoxemia, and low oxygen in the blood. There can also be a cough with a small amount of sputum from inflammation in the small bronchioles that causes excess mucus production via goblet cells. But this is a lot different from productive cough with lots of sputum that is seen in chronic bronchitis. Over time, trapping and hyperinflation of the lungs can cause individuals to develop a barrel-shaped chest, and on X-ray, individuals might have an increased anterior-posterior diameter, a flattened diaphragm, and increased lung field lucency. That means they look more transparent in a plain radiograph. All right, so in normal physiology, there is a process that we already review in chronic bronchitis, which is called hypoxemic vasoconstriction, where for some reason one area of the lungs has poor gas exchange, then the blood is shifted or is looking for other areas in an attempt to get better gas exchange. This works normally if the affected area is small, but if it's very large, then this general vasoconstriction will cause pulmonary hypertension. Then the right side heart has to work harder, so it hypertrophies, and at the end this is going to cause right-sided heart failure, which is a process known as cor pulmonale. All right, so treatment of emphysema largely involves reducing the risk factors, which is smoking, and managing associated illnesses. In the old times, you could see, maybe you can still see it, people with oxygen, but they keep on smoking, like the guy in this picture. Smoking is terrible, isn't it? So there's no cure for this disease, but you need to stop smoking, because this way you can increase lifespan and reduce mortality. Otherwise, no way out. So these people, as said, as this guy, they may use supplemental oxygen, as well as certain medications like bronchodilators, inhale steroids, and antibiotics to control any secondary infection that may appear in emphysema. And to finish, here you have a vintage picture of the two phenotypes of COPD, the emphysema pink puffer and the chronic bronchitis blue blotter. And remember, this is all due to smoking.
Thanks.
All right, thank you for watching.